Hello everyone, my name is Radha. I did this presentation on lung cancer, so let's get started. So for our agenda, we will get to meet our patient. We will discuss her symptoms and any relevant history that she has. We'll also talk about her physical findings, our diagnosis, and any relevant diagnostic testing, as well as the treatment plan. So let's meet our patient. Our patient is MT. She is a 63-year-old woman, presents to the urgent care center, complaining of productive cough with whitish sputum. She's also complaining of chest pain, increasing restlessness, and some fatigue. The patient states that she has had a recent 14-pound unintentional weight loss as well as loss of appetite. Upon further evaluation, the patient states that she's been hospitalized multiple times in the past due to pneumonia. For allergies, she denies having any allergies to medications, food, or environmental factors. For past medical history, she has hypertension and diabetes type 2. Her past surgical history is not significant at the moment. For medications, she does take metformin and lisinopril. Family history, her mother passed away at the age of 79 from breast cancer. Social history, she's a current smoker. She smokes about 1 pack a day for 45 years. For physical exam, her vitals are as follows. She is afebrile. Her blood pressure is 108/54. Respiratory rate is 26 per minute. Heart rate is 82 beats per minute. And she's currently statting 99% on room air. For general appearance, the patient is in no apparent distress. She's awake, alert, and oriented times 4, and answers questions appropriately, although requires short breaks to catch her breath. She appears to be underweight. For clinical presentations, on physical exam, the patient has some dullness to percussion and decreased breath sounds. She also has increased tactile vocal fremitus and vocal renaissance. Examinations of other systems is within normal limits. For our diagnosis, she is diagnosed with lung cancer, and one would diagnose based on the presenting symptoms. For at this point, her signs and symptoms, any early signs and symptoms, includes fatigue, shortness of breath, back or chest pain. For late signs and symptoms, the person would have chronic cough, fatigue, dyspnea, back chest pain, hemoptysis, and weight loss. Also, for the imaging, we would do CT, we'll do MRI and X-rays and so on and so forth, just to take a look at her inner body. For risk factors, for lung cancer is increased about 13 folds for someone who smokes, and she is a smoker. Majority of these are found in women, and she's also a woman. Um, Women are 3 times more likely to get lung cancer. The person is also at an increased risk for lung cancer if they have had radon exposure, any family history of cancer, TB, or pneumonia. In this case, she has had multiple episodes of pneumonia, which is an inflammation lung disease. For diagnostic studies, so for patients, as such, we would do a complete blood work, which would include their hemoglobin and hematocrit, white blood count, neutrophils, lymphocytes, monocytes, eosinophil, basophils, MCV, MCH, RDW, platelets, electrolytes, including sodium and potassium. We would also test their B1 level, their creatinine, their BT, total protein, LDH level, albumin, PSA, D-dimer, and PFT. Lung cancer is determined by biopsy, but it is detected by either chest X-ray, CT, PET scan, or the MRI. The MRI, we would do it of the brain if we just in case it has spread to the brain. We would also do bronchoscopy. We'll do sputum cytology, This patient would be sent to interventional radiology just to take a biopsy sample. And majority of the time, it'll be from the liver because the liver is the first organ that the tumor would be spread to. And majority of the cases, it would be small cell carcinoma. So for imaging, here we have few images that I have put up of their CT, their MRI, their X-ray, of how it would present for someone who has lung cancer. So how would we treat a patient once they've been diagnosed with lung cancer? We would look at their signs and symptoms. We'll do screening studies that would suggest lung cancer. Tissue diagnosis must be established, of course. The tumor tissue can be obtained by the bronchial biopsy during fiber optic bronchoscopy, which is done by a fine needle aspiration, and they would use a CT guidance. For presentation, SCLC usually has already spread, and by the time the patient really shows a distinct signs and symptoms, it has already been a little too late. And in this point, they would already have spread, and surgery is unlikely to be curative and is managed primarily by chemotherapy without radiotherapy. Um, if it's the patient hasn't gotten to that level, surgery would be an option, such as lobectomy and pneumectomy. Chemotherapy is also an option. Two medications are normally used, carboplatin and paclitaxel. And both of these medications, they're used because they inhibit DNA synthesis, causing death of rapidly dividing cells. Another medication that's also used is bevacizumab, which also inhibits new blood vessel growth, causing decreased metastasis. Chemotherapy is also an option, but one thing for us to be aware of that chemotherapy does cause hair loss, healthy tissue necrosis, immunosuppression, and anemia. And anybody who is getting chemotherapy should know that might be caused at the end of it. For radiation, patients also should be made aware that it can cause skin irritation, hair loss, dry cough, and shortness of breath as it lowers surfactant. In that case, administration of steroids might be beneficial. It can also cause them to be fatigued and might lead to radiation pneumonitis. These are my references. Thank you so much for listening to my presentation. I hope you learned so much from as much as I did, and thank you for listening. Have a wonderful day.